SCHC stands for Scarborough Centre for Healthy Communities. We're quite a big team, from doctors to nurse practitioners, nurses, chiropodists, dietitians.
There are recent studies that show that Filipino women have a higher risk for breast cancer.
There's a higher incidence among Filipina women to develop cancer at between the age of 40 to 59, and it can be due to a lot of factors.
We have a very, very effective way to prevent measles.
Who can get breast cancer?
So anyone can get breast cancer as long as you have breast tissue. It affects 1 in 8 women in their lifetime. It can affect even men. We can find breast cancers that actually your body would have taken care of on its own, and we can actually over-treat cancers.
Should everyone get the shingles vaccine?
So everyone over the age of 65 should be getting the shingles vaccination. It could lead to things like chronic nerve pain without a vaccination. We do provide services to people who have OHIP and also to people who are uninsured.
But now we can look at health as something that are influenced by non-medical factors.
Life in Canada can be challenging, whether you're new to the country or have been here for years. But once you unlock the right services, build connections, and access the right support, you can truly thrive. Canada is a beautiful country with so much to offer, and no one should have to navigate its challenges alone. Welcome to Thrive in Canada, where we explore real-life experiences, practical solutions, and expert insights to help you build a fulfilling life here. Today's episode focuses on something fundamental to thrive in any country: your health. Whether it's finding the right services, getting screened for diseases early, or understanding your options even without a family doctor, health access is key to quality of life. So to help us break it down, we're joined by guests from the Scarborough Centre for Healthy Communities, a leading organization offering essential health and wellness support for newcomers, seniors, families, and underserved communities in Toronto's East End. We're joined by Mish Waraksa, nurse practitioner specializing in hepatitis C, and Mimi Diumano, community health ambassador with a preventative care program. If you've ever felt unsure about where to go for help or whether you qualify for care, this episode is for you. So let's get started. First of all, can you tell us first about SCHC and what the organization is about and what services it offers?
Yes, SCHC stands for Scarborough Centre for Healthy Communities. We're an accredited community health organization. We provide holistic health and wellness services for people of all ages. So we started in 1977 as West Hill Community Services. And now, today, we've grown to offer over 46 programs across 13 locations in Scarborough. Most of our clients go or visit our more well-known locations in Eglinton. It's called the Mid-Scarborough Hub. And then there's another one at 629 Markham. And then we have one at 520 Ellesmere. We're quite a big team at SCHC. We're composed of over 300 staff, from doctors to nurse practitioners, nurses, chiropodists, dietitians, community workers, social workers, even program coordinators and services. And our staff are also working directly in high-need communities. It includes Toronto community housing sites. And we're also proud to say that we are offering over 25 languages in running our programs. We are also supported by over 250 placement students and volunteers who help us run our programs across Scarborough. And as for the services, maybe Michigan.
Yeah, there's quite a few services, things like diabetes teams. You mentioned chiropody, so foot care. Health promotion activities, so getting messages about vaccination and health screening out into the community, and also providing primary care from the community health center clinics located throughout Scarborough.
It can only be tapped by people who live in Scarborough? Is that how it works?
Yeah, you have to live in Scarborough, but we do provide services to people who have OHIP and also to people who are uninsured or do not even have status in Canada as well.
We're going to go into that later. But first, since 1977, SCHC has grown tremendously. What would you say has been the biggest shift when it comes to the community health needs over the years?
We used to see health before as medically focused, but now we can look at health as something that are influenced by non-medical factors, and we call that social determinants of health. This can include housing, employment, that sense of belonging. At SCHC, we recognize that, and instead of asking, do you have a family doctor, we're now beginning to ask, do you have a safe place to live? Can you afford healthy food? Do you have a community that you can connect with? And looking health as an overall wellness journey is something that has been shifted, has evolved throughout the years, and that's what we're trying to address now.
Wow, that's super good to know. You offer, as you said, 36 or so, maybe close to 40 programs. How do you know which one to prioritize, which services to prioritize at one point?
Yeah, it's really important to listen. So we engage and we listen to the community. So it can be through an ongoing feedback. It can be through data that we get from our research. It can also be through community engagement activities. Like, for example, we have a mobile health unit where we go to different sites and we would talk to people, have conversations with them. And based on this, we also have needs assessment. And based on what people tell us, like what they need most, whether it's mental health counseling, diabetes, or vaccine support, that's where our services evolve.
Can you share an example of like a success story or a positive community impact that reflects the mission of the organization?
Yes, I just met one of our clients recently. I'm not sure if I can mention her name.
We don't need to reveal the names.
Okay, so she's a long time client. She's been a client of SCHC for almost 15 years. And she came here as a newcomer, no OHIP, and she needed medication and a doctor. It was still she was sharing that it was still a West Hill community service at that time, and she was provided with a primary care doctor and a nurse who helped her manage her treatment, her health. And then there was also a social worker who actually helped her in navigating community support services for her. Because aside from, the primary care, we also provide community services. So, and there was a relationship that was built, and it was through the social worker's encouragement that she actually pursued her education at a university. She has 3 kids She was a mother of 3, and she said that because of that encouragement, she made time for herself, to improve herself, to study, and then she just graduated international studies here in Toronto, and now she wants to give back. And I think one of the remarkable things that she shared during that conversation is that she said that she's trying hard on a daily basis to pass on the compassion and kindness that she learned from SCHC to her children. And it's good because, her story is just a testament that when you get the right support for people, community stays healthy, and also, kindness persists.
I'm getting goosebumps just listening to that story.
Yeah.
I mean, it is a holistic kind of support that you gave this particular person who started with no OHIP, 3 children, and you were able to give her not just the medical guidance on how to, guide her through whatever medical condition she had, but you also had social support for her, and even continuing her study.
Yes.
That is amazing. And do you think people in Scarborough know about these services?
I think we have a good presence in the community, and people recognize the name and recognize our logo. And I think people sometimes don't know the breadth of services that we're providing, and that it's not just a clinic, it's not just somewhere where you can see a family doctor or nurse practitioner, that there is all of these other services available, that you can be supported to access things like food banks, to get new ID, to get mental health counseling. So often people are coming in for one service, and then we're introducing them to the full range of services that are available.
How does SCHC coordinate with the hospitals or the local clinics or government services to ensure the seamless help for those who need it?
Yeah, so we're all part of the Ontario Health Team, which has created some partnerships between the hospital and our organization. Sometimes that's in the form of health programs or in research opportunities. But we can always be referring to the hospital, and the hospital can refer back to our services, ensuring that that's really seamless and people have all of their needs met, especially if you're leaving hospital and you don't have the supports that you need.
Do people in Scarborough have family doctors? I mean, that's one of the issues now in Canada. In Scarborough, the percentage of residents and family doctors, is it pretty much on the higher scale?
I would say no. I think a lot of people don't have family doctors, and just like it's an issue throughout Ontario, it's difficult to get a family doctor. And then a lot of the family doctors that we have in Scarborough are often practicing as solo practitioners as well. And that works for a lot of people, but for some people, they would benefit from services where there is things like chiropody, social work, all of those other services that work in partnership with a doctor. So it's good to have that opportunity for people that have more complex needs as well.
So the one you were talking about earlier, is that what you mean by a wraparound approach when SCHC uses this term?
Yes, a wraparound approach. Maybe I can give you an example. Like, for example, there's mother of two a newcomer. She's a newcomer, and she arrives in Scarborough without OHIP, and she has a chronic disease. She goes to SCHC, and then there's a primary doctor or a nurse practitioner who can support her. And then during the conversation, she shared that the thing is, I have a work, but I don't have enough savings for groceries or healthy snacks for my kids. So what we do, we have, health resource navigators who can who refers the client to a food bank and also an income program support. So that's already addressing the financial insecurity. And also, because she's been very stressed about it, we have a mental case health worker who can do counseling or health coaching with the client. And then we also learned that the client is also living with her father, who is a senior and who feels lonely because he doesn't know anyone. So what we do is we connect the dad to adult living program that we also have at SCHC, where he can meet with a lot of seniors, engage in a lot of recreational activities and programs, and maybe also have access to transportation from getting to the center to the home. So that's another layer of support. And then because she's working for longer hours, and she doesn't have time for her kids in terms of doing their homework. So what we do is we link the kids to our youth programs where they can join the homework clubs or like cooking classes or anything that interests them, leadership course or leadership programs. And then the kids are learning, they're having fun, at the same time establishing friendship in a safe space. That's what wraparound support is about.
I know you're here as representatives of SCHC. I haven't been in Canada for 10 years. I haven't been here long. Does this also happen in other communities? I mean, this is wonderful if you have services like this to tap. And I don't know if you'll be able to answer that because you're here for Scarborough. But I'm just wondering, is this something that's replicated in all of the communities in Canada?
I think Scarborough's Community Health Centre Centre for Healthy Communities is special because it does have so many programs and so many locations that it can really be embedded in the community itself, especially with the presence in some of the community housing buildings, for example. I think it really exemplifies meeting people where they are and going out into the community to provide these services. So I think it's unique in that way, but we do have other community health centers that do provide sort of wraparound services for people. And I think what's really important with that wraparound model is that all of those services are coming to the person rather than that person having to reach out and seek them out, wait on referrals, try and find all that
Right.
information themselves, is that the team actually comes to them to help with those things.
Yeah, it's
So you
an
me-
integrated model of care.
Sorry. And
It's an integrated model of care.
yeah, and it's something that is worthy of modeling. You mentioned earlier about those without OHIP. How are they serviced? Can they tap the same services as you were saying earlier if they have no OHIP coverage?
Yeah, they can access almost all of the programs in SCHC. As well, for primary care, that can be something that's really difficult for people without OHIP to access. But we do actually prioritize taking people without who are uninsured, who don't have OHIP. And there is funding within the organization. Even if people need to see a doctor outside of the clinic, if they have to be hospitalized, have a surgery, there's actually funding that can support that person to get other services even outside the organization itself.
Wow, that's awesome. How can someone volunteer to get involved in SCHC?
Yes, we're always looking for volunteers. They can reach us they can visit us at our website, whether they want to help with the food deliveries, be a homework tutor, in the bereavement support, friendly visiting program, or just fundraising. We have roles for everyone. They can just contact us at volunteer programs at schc.ca. If they are not digitally inclined, they can also visit us in any of our locations, and we'll be happy to support them with their questions.
So now let's move on to breast cancer screening. What is the definition of cancer? What is breast cancer?
So cancer is when a group of cells start to grow out of control, and then they can also go on to spread into other areas of the body and start causing other issues. Breast cancer is cancer that's growing in the breast itself, and then it can spread elsewhere. It affects 1 in 8 women in their lifetime, but it can affect even men or anyone with breast tissue.
Yeah, that's the misconception, right? Like they think only women can get breast cancer.
Right.
But men can also get breast cancer. But how often does
Pretty
that
rare,
happen?
pretty rarely, like about 1% of cases, but it's something definitely to know if you're a man.
Right.
Also, that if you're feeling something that's abnormal, it's worth getting checked out.
Who can get breast cancer?
So anyone can get breast cancer as long as you have breast tissue.
Okay, and can we prevent getting it?
Can we prevent breast cancer? There's certainly certain factors that can help to prevent breast cancer. Lifestyle, eating well, maintaining a healthy body weight, limiting how much alcohol you're drinking, avoiding smoking. But the majority of cases, we're not going to be able to find a reason why it happened. It's very complex. It can do with the environment, with genetics. So it's not that we can prevent all cases.
What is breast cancer screening?
Breast cancer screening is usually done by a mammogram. So it's a type of X-ray that's done of the breast tissue itself. They recommend that all women over the age of 50 start to get breast cancer screening every 2 years. And that's actually something that's recently changed, is that you now have the option to start breast cancer screening at the age of 40.
Why is this important?
This is important because the earlier that we can detect breast cancer, the better that the treatment options are. The treatment itself may not need to be as aggressive, not have as many side effects, and be more effective for the person.
There's another school of thought, and sometimes it can be confusing for the patients who are not in the medical field. There's a belief that mammograms can even start breast cancer. Like even if you didn't have any, but you underwent mammogram, it can even start it.
So the amount of radiation that you get from an X-ray and from a mammogram is very, very small. So there's very little risk to getting the screening done. There is the question about when you start screening and when there are some risks involved with getting screening, because we can find breast cancers that actually your body would have taken care of on its own, and we can actually overtreat cancers. So someone could get treatment like a mastectomy for a cancer that maybe if they hadn't have been screened would have resolved. But these are very rare cases. And so it's still up to that person whether they want to be screening early from the age of 40 or whether they'd want to start later and start at age 50 when we know that the benefits are really clear by that time.
Okay, so that at least it's good to know. And sometimes not all medical practitioners explain it that way.
Right.
Unfortunately, like they don't give you the whole picture. How important do you think should the patient know about his or her condition? Because sometimes we just leave it up to the expert because they're the experts. So we follow what they tell us to do. But there are also, like I said, different schools of thought or different medical practitioners believing in different things. At a certain point, it will find a convergence somewhere. But there's a time and place when the patient has to make a decision. And for that patient to have an informed decision, it's also the medical practitioner, at least in my own personal belief. And I don't know if this is how it's done by the medical doctors and nurse practitioners, to inform and give the whole information to the patient. How important is that, do you think?
I think that's very important, and certainly a part of my own philosophy to care is that we should be giving the person as much information as possible for them to be making that decision for themselves, rather than just being prescriptive and telling you, you know, this is the rule and you have to start getting screening at this time. It's important for someone to have all the information and then be making that choice based off of their own values, evaluation of their own risks, and then their own choice to what they want to do with their health. And certainly it's also very individual when it comes to breast cancer. Most people who have breast cancer don't have a family history, but certainly having a family history means that you're at an increased risk, and you may need to get different kinds of screening or screening earlier in life or screening with different frequency, maybe more often than others.
So where and how can they get screened?
Yeah, if you do have a family physician or a nurse practitioner, you can talk to them and get a referral for breast cancer screening starting at age 40 if you're someone without any additional risks, or at age 50. Again, that's a personal choice. But a referral actually isn't needed. So we have the Ontario Breast Screening Program, and that runs at most diagnostic centers. So most X-ray, ultrasound clinics are part of this program, and you can actually give them a call directly or call the main phone line for the Ontario Breast Screening Program and get referred directly to the program, even if you don't have a provider yourself.
There are recent studies that show that Filipino women have a higher risk for breast cancer. Why is this?
Yes, there's a study from the Canadian Task Force on Preventative Care that there's a higher incidence among Filipino women to develop cancer at the age of between the age of 40 to 59, and it can be due to a lot of factors like what Mish shared. It can be genetics or lifestyle change or lifestyle patterns, and we also have to recognize that many Filipinas here in Toronto, they're working in the hospitality and healthcare industry. And these are not 9 to 5 jobs. It's a highly stressful jobs that sometimes would require them to work more than 12 hours. And also sometimes because they work at the hospitals or the hotels or retail, their morning becomes night and the night becomes morning. And it actually affects the cycle, and it can cause mental health, and also they don't have enough time for physical activities, and sometimes even after work they would take care of their children or their parents, because Filipinas are very family oriented, right? And we also want to work hard. And many of the Filipinas that I had conversations with, they were telling me, I mean, I've been juggling multiple roles. I'm a mother, I'm a caregiver to my parents, and I work, and you know, finding a healthcare, childcare, or maybe taking some time off work just to get screened would be hard for me. It's it's just about also balance. And then there's also this stigma or fear about cancer, especially in immigrant communities. Sometimes even in our family, when we talk cancer, we would identify it with death, with spending too much for the treatment. And these are not the things that we want to incorporate in our daily conversations. And also sometimes there's this attitude that, okay, I don't feel sick. then I have nothing to worry about. I'm okay. At SCHC, we want to change that narrative. That's why it's also important to have, aside from, having conversations with the doctors about cancer awareness or the symptoms, we also organize, community health awareness about cancer screening. We go to our communities, do workshops with our partners or at different sites, just to help people make better informed about cancer, about their health in general, to make informed decisions. We wanted to normalize these conversations because the more we do it, the more we can save lives. That's what we are working for.
That's a lot of layers in what you said there. First of all, the lifestyle and the challenges of being an immigrant, contributing to the stress, contributing to your body not being able to metabolize all these stresses, and therefore at a certain point, giving in to things like cancer. So they're more prone to that because we know that there was a whole drove of Filipino population who went here as caregivers. And they're mostly mothers. And most of them either left their children at home or left their partners at home and brought their children. And we know how difficult it is for a single mother, plus being an immigrant, plus having to navigate the financial challenges. So that's contributing to it. And then because that's your lifestyle, you're so busy, you don't have time to screen yourself. And then there's the stigma on top of that, okay, finally I have the time to screen myself, but then I'm feeling okay, but then I don't want to know about it because cancer equals death, which is very prevalent in our culture. That's how we think of cancer. We probably also don't like or fear how people will react when we do find out that we're positive. Like, for example, if we have cancer, because the people around us will...
That's true.
All feel sad. We're the ones who are going to have to cheer them up. And do we have the energy to do that? No.
Yeah.
And, we don't want to give them that burden. Like I have... For example, I'm that caregiver who went to Canada and my parents are back home in the Philippines. I don't want to deliver the news that, hey, I have cancer. I'm already worried about them in the Philippines, like how they're doing. And for me to deliver these news, I mean, there's so many levels as to why they're not going to get screened.
Yeah.
And as to why maybe the numbers are increasing, as you said. Can you give us a little bit of a background when they found out about the Filipina cases and...
I think that the study was done in 2024. I mean, it was published in 2024.
So it's a very new study.
It's a very recent. Yeah.
And how much do we know? How much of an increase? How much of a spike, or compared to other races? No, we don't.
We'll have to check on that, like the percentage of increase. We have to check on
but
that.
at least it's good for us to know that our particular race, because knowing is half the battle, right? It's already 50% of what you need to digest and to be able to prevent or cure it or heal yourself. What are some of the myths and misconceptions about breast cancer and breast cancer screening that you encounter in your work?
Mammograms are painful. We always hear that. I don't like it's painful.
But it is. No, I never.
There might be discomfort.
Yeah.
There might be discomfort. But I think it's worse. It's worse the pain. I mean,
the discomfort.
Yeah.
Yeah.
And
I guess everyone has a different pain threshold.
it is.
So
Yeah, that's true. That's
for
true.
some, I'll take it back because I said earlier that it is. Now I'm looking back. I'm trying to remember the mammogram that I did. It is more of a discomfort than pain, at least for me. I can't say that for everyone.
Yeah, and there's also, at least these are based on my engagement on site. So some are like, do I need a family doctor for that? But it's not, do I need to, how do I, like, they thought that they need to have a family doctor before they're able to get the mammogram. But good thing that, no, it's not necessary anymore. They can do self-referral. When you start age 40 and you feel like you want to get mammogram, you can book an appointment with Ontario Health.
I think the biggest myth would be, I feel fine, so I don't need one, right? And the whole reason of doing screening asymptomatically, so when you don't have any symptoms, is so that we can catch it so much earlier. and have better treatment and less intensive treatment. And I think if we're thinking about women having to maintain social roles, we want to make sure that we can be that healthy person, that we do have the health we need to help the people around us. And certainly getting treated sooner can increase your odds of that.
Mm-hmm.
Maybe let's just repeat that, the one that they don't need a family doctor, because we do still get that kind of question and perception from others. Maybe just reiterate that point.
Yeah, it's very difficult to find a family doctor in Ontario and certainly in Scarborough as well. And you don't need to have a family doctor or nurse practitioner in order to get breast cancer screening done. You can call directly to the Ontario breast screening program or call to an X-ray or ultrasound location that's part of the program and get an appointment directly.
For women who are afraid or anxious of mammograms, like what you said earlier, what can your message for them be?
And it is a completely valid feeling to get scared. And what we usually tell them, okay, you can, if they can bring their friend, any family member for support.
I think it's exploring the reasons why they're afraid. Is it that they're afraid of getting the results? Is it that they're afraid of the pain with the process? And really, it's a very individual experience to explore what's going to help ease that pain as well, or ease that discomfort around the process.
What about for transgender or non-binary individuals? Is the screening process different for them?
So the only difference is like everyone that has breast tissue can get breast cancer, right? So if you're someone who's transitioned and had top surgery and have had a mastectomy, then you don't need to have breast cancer screening because that tissue's been removed. But if you're a trans woman or someone who's trans feminine who's been taking estrogen, if you've been taking hormone replacement for 5 years or more, then you do need breast cancer screening the same as other women.
Okay, and it's the same test. You go through the same process. Okay. You mentioned support is available even during screening. Can you mention some instances when people needed support during screening? And what could we do, like, while they're there? I can imagine, because I also have some medical procedures that I'm scared of doing. A simple drawing of blood. You know, I need to have my husband there. I need to have someone whose hand I can squeeze. Is this the same case? Like, what kind of support do you give them when they need it while the screening is ongoing?
Yes, maybe asking them if they're okay. I personally haven't been in a situation when they're doing the screening and I was there. It hasn't been, I've never been into that situation. But from my experience, if I am the client, then I would receive just the nurse practitioner or the nurse or just checking in. How are you feeling? It's going to be very short. It won't take long. So I think that helps.
I think also thinking of the other reasons why there's barriers to getting mammograms. Sometimes people need help with booking the appointment, getting to the appointment, being able to remember an appointment. And some people don't even have phones, some people that we work with. So those are other support services that SCHC can provide to help get people to the appointment itself and get that appointment booked.
So let's say after the screening, it turned out to be positive. What's the next step?
So it depends on what the findings are. But often if there is something abnormal, then you would go on to get a breast biopsy done. So a small amount of the tissue would be removed and looked at under a microscope to determine what type of cells are growing there. And then from that could be a false positive, so nothing was found. It could be something that needs other treatment, like a surgery to remove the tissue or medications, etc.
Why do you think it's still important today, even for healthy adults?
Yeah, it's important for healthy adults because we're still at risk for plenty of infectious diseases, and not even just for ourselves, but to help protect other people in our community, especially children who are too young to get vaccinations. By us being vaccinated, we help to protect those people, and people who might not have a strong immune system, like the elderly or people who are on immunosuppressant medications. Us being vaccinated actually helps to protect them as well. And as we're seing outbreaks of different illnesses, especially measles outbreaks in Ontario, it really brings to mind how important it is that all of the people in our community are protected, that they're vaccinated.
How do you advise us to look at these development lately about measles coming back?
Yeah, I mean, it's an illness that we've really had under control for a long time, and we've had a very effective vaccine against it for decades. Anyone who's born after 1970 should receive 2 doses of the measles vaccination. And unfortunately, there has been a lot of fear around vaccinations that's increased in the last few years. So we're seeing certain communities where the vaccination rates are a lot lower. And we're seeing outbreaks amongst children and other even adults who are getting measles.
But do you think it's still easy for it? It's still controllable. We can still put it back inside the jar where it came from, and we can close the lid. And
yeah, we have a very, very effective way to prevent measles. So it's about promoting that and making sure that people feel comfortable and are able to access vaccinations.
Is it just a matter of young kids just continuing to get vaccinated for measles, or do adults also have to get boosters now that it's coming back?
So usually if you've received 2 vaccinations, then you're set for life. You can get checked by your doctor to ensure that you do still have immunity to measles, but for most people, getting 2 vaccines is adequate.
Okay, so it's mostly just the
children, but we do know that some people have missed their vaccinations, whether that was back home and now they've immigrated here and they haven't had the vaccinations yet, or a lot of us received vaccinations in school and it's possible, did you miss the day when they came to do the measles vaccination? So for me, it's important to check and make sure that your vaccinations are up to date.
Okay. Some people are asking, are vaccinations in Canada safe? And how are they tested?
Yeah, vaccinations in Canada are very safe. They're controlled by the National Advisory Committee on Immunization, and they're tested in tens of thousands of people before they're deployed to the general public to make sure that there isn't severe side effects, that they're safe to be giving, and that they're really effective against disease. Even when a vaccine doesn't 100% cover against disease, we still have decreased severity of that disease. Like with a COVID vaccine, we often know it can still be possible to get it, but it can keep you out of hospital and keep you from getting severe disease.
What common vaccines should adults, newcomers, and seniors know about?
Yeah, certainly the tetanus vaccination. So tetanus, we should be getting updated every 10 years. That's an easy one to forget about. For the elderly, the pneumococcal vaccine and shingles vaccinations. And then for all of us to be getting our flu vaccine and our COVID vaccinations up to date.
Should everyone get the shingles vaccine?
So everyone over the age of 65 should be getting the shingles vaccination. Shingles, very preventative, very able to be prevented with the vaccine. And it can have really severe outcomes. It could lead to things like chronic nerve pain without a vaccination.
Some people still feel nervous about vaccines. How do you address that in the organization?
Yes, we were doing health sessions, like even the same with cancer screening. We're doing a lot of community sessions to provide information about the vaccine. And aside from that, we have VaxFacts, where we can connect them to VaxFacts. So what we do with the VaxFacts is that when you they can book an appointment with a doctor. We can also help with the booking, and then the doctor will call them at the time that there is a preferred time, and then they can ask questions to the doctor about vaccines and what are the things that they should do before, even after, what are the expectations from the vaccine, like all the things that they need to ask, what they want to ask, it will be answered through VaxFacts, by the doctor through the VaxFacts program. It's a 10 to 20 minute call for doctor, no fee at all. It's free. And yes, just set an appointment, choose your preferred time and date, and then the doctor will call you.
Wow. They can do this through the website, the SCHC website? Or
they can check the VaxFacts Plus website, and then it's very easy to navigate. They can already see the instructions, and if they're having a hard time booking it, they can go to us so that we can also help with the booking. That's what we usually do when we go to the community. If they're interested, and then we book them right away. So
Yeah, because some people will just not do anything. Like I have questions, I have doubts about vaccines, and then I stop there. I just don't do anything about it, and I don't get my vaccine as well, or I don't give my children vaccine.
Yeah.
So yeah, it's good if people can be proactive about asking about their doubts. But I'm sure there's a lot of people there who are not even gonna, again, the busy schedule, they're not even gonna ask. They're just gonna like not have the vaccines.
Yeah, that's
perhaps.
why we meet people where we are, and it's also good that we're providing multi-language services.
Right.
Because sometimes it's also hard
It's a barrier.
to talk about your health in a different language.
Right.
So, and it also helps us build trust, especially when we're having conversations about cancer, vaccine. So many of our staff are actually, bilingual, trilingual, and it helps break down that barrier that the language access is very important for people to get appropriate information about healthcare. And for us, it's still about, personal decisions. It's about personal choice.
Right.
But if we can give them the information that they need so that they can make better informed decisions, then it's
Yeah,
great.
for sure. That's good to know. Any other maybe parting message or information that we left out that you want people to know?
So I think around where vaccines are available, certainly if you have a family doctor, nurse practitioner, you can see them and talk to them about getting vaccinations in their office. But if you don't, there's also freestanding clinics with Toronto Public Health that provides immunization clinics to the public, and within pharmacies as well, talking to your pharmacist about what vaccinations could be available there as well.
Please feel free to, drop by any of our sites or check our website if you need support, whether it's about healthcare or, employment, housing, or just have fun with and build connections with your community. We'll support you with that.
That's actually really very good to know that health is being looked at that way now. That it's not just the medical needs, but the holistic need of the person. I'm very curious about like your practice. What do you see that's more needed nowadays, or what have you observed with the patients, with the community? What are the things that you think are up there in terms of what we should know?
Certainly the things that we see becoming more and more difficult these days is affording adequate housing, and getting access to good and healthy food. That's become difficult for a lot of families to be able to access, and how that has impacts on our health. Mental health as well, and mental health access can be really difficult. So it's great to be a part of an organization where we can connect people for free to things like counseling, and faster appointments to psychiatry, etc., when people need it, because we often have really long wait times in Ontario to access mental health, or if they can access it at all.
Is there a mental health access, or what sort of facilities or assistance can you give for those who need mental health assistance?
Yes, for our team, I'm part of the preventative care team. So we have mental health caseworkers. They can book one-on-one session with them, and it's also free and it's accessible. So we work around their schedules, and even the method of meeting. If they want to be over the phone, if they want to do in person or virtual, we're quite flexible with that.
How do they initiate? How do they reach out if they need help mentally?
There's many ways. Sometimes we just meet them during our community engagement. Some would call SCHC, some would call our intake, and some would connect with community health ambassadors. We always make our contact details available through our website and the flyers and the brochures that we do, and also just with their daily interaction with them.
Are they psychotherapists or social workers
Yes.
who can talk to them? And is it just a one-time thing, or can they
until they feel they're okay. So we're also, I'll be speaking for our program. We would have like 30-day check-in just to check whether there has been, progress with the goals that they created for themselves. It's a continuous process. It's not a one-time, big time. Okay, I don't feel well, then I
Right.
talk and then it's done. No, we make sure that we're supporting you all throughout the process until you feel that you're ready to move forward.
And again, is this only for people from Scarborough? Do they need to have OHIP to be able to tap this mental health service?
Yeah, we focus on people living in Scarborough. But what we do is if they're coming from a different area, then we connect them to a community health center that offers the same services but closest to them for accessibility reasons. So because we also want people to utilize services that are accessible to them, it would be easier and more cost effective. So that's what we do. We still connect. We don't turn people away. We support.
And that's very good, the unit that you're with, the preventative care, because we do really want to prevent things before they happen, especially with our health. More often when they manifest already, it's kind of harder to reverse it rather than knowing it much early on when, as you said earlier, no symptoms are there yet. You can make lifestyle changes. We can help you with things that are going on in your life because this is the reality that's causing the health issues later on. That's very, very good to know. Thank you so much. I learned a lot today. Obviously, we've touched on a lot of areas from getting screened for breast cancer to how community health workers are helping Scarborough residents and even people from outside Scarborough, insured or not, to stay informed and supported. The message is simple. You don't need to figure things out alone. Whether you're navigating cancer screening, mental health care, or getting your kids vaccinated, organizations like the SCHC exist to walk alongside you. So we want to thank our guests, Mish and Mimi, of course, from the Scarborough Health Center for Healthy Communities, for shedding light on these important topics and for the work that they do every day to make healthcare more inclusive and accessible for all. Join us again next time on Thrive in Canada, where we continue to explore the real challenges and experiences of life here in the true North, and most importantly, how to thrive. Take care, stay informed, and we'll see you in the next episode.